Well, Alberta's measles outbreak has hit a new milestone. Cases in that province have now surpassed those confirmed across the entire U.S. Mark Cockersole is tracking the data and joins us now. And Mark, let's begin with how bad it's gotten in Alberta.
Yeah, Ian, Alberta is not the first. It's not the only province to surpass that threshold so far. However, as you mentioned, per capita, these numbers don't exactly look great for Alberta. It joins Ontario as the second province now to surpass the United States in terms of confirmed measles cases. Let's take a look at the numbers for the three. You will see that Alberta now has 1,314 cases as of noon local time today, the latest update. When you look at Ontario, 1,934 confirmed cases as of the last update in that province on Thursday. In the United States, there is a total of 1,288 confirmed cases. That's as of the last update by the CDC late last week. Now, of course, there are concerns that many of those numbers are underreported, that there are a lot more undiagnosed, undetected cases there, but those are the official confirmed numbers as we stand. Within Alberta, provincial data is showing, in terms of serious cases, 102 hospitalizations reported by provincial health authorities, 15 ICU admissions. The good news, no deaths as of July 5th, the last update. But these numbers are concerning for Alberta, again, on a per capita level, because when you look at the numbers population-wise, first off, Ontario has a higher population than Alberta by several orders of magnitude. In the United States, of course, it's an entire country. It has a higher population than Alberta and Ontario by several orders of magnitude. So as for why this is happening, there are concerns that vaccination rates are low. We often hear people say, I thought measles was eradicated in Canada. It was not. Technically, the term is that it was eliminated in Canada, and that's when you have a vaccination rate of about 95%, herd immunity, keeping the numbers low, but vaccination rates have dropped. People are traveling a lot more nowadays. Of course, measles is pretty much one of, if not the most easily spreadable conditions out there, and so that all plays into this. And when you think about Alberta, if you think the numbers look bad on a per capita basis now, the Calgary Stampede just wrapped up this last weekend. It won't be long now. We're in mid-July. Kids are going back to school very soon. Craig Jenny with the University of Calgary says don't expect the numbers to drop anytime soon.
Unfortunately, we can anticipate sustained transmission now for the foreseeable future, at least the next several weeks to even several months. The only way this is really going to come down is if vaccine rates go up. And we are seeing some encouraging data in Alberta. We have seen an uptake in vaccine, so that's great. It's still small. When we look at the overall numbers, there are parts of Alberta where fewer than 50% of people are fully vaccinated. Those areas require a lot of doses to be administered to get to that herd immunity. So, we do have our work cut out for us over the next several months.
And Ian, just to give you a look at where Alberta stands, when you look at across the country, the numbers across the country, federal data shows that 58% of new measles cases in the last full week of June were in Alberta. So that last week, it carried more than half of the country's caseload.
All right, Mark, thank you very much. Well, this is an important story, and let's get some more analysis on it. Dr. Lynora Saxinger joins us now. She's an infectious disease specialist at the University of Alberta, and she joins us from Edmonton. Dr. Saxinger, what's your first thought when you look at these latest numbers from your home province?
Well, I mean, they're absolutely terrible. It's obviously not coming under control. I never expected that we'd hit numbers like this in my lifetime necessarily as an infectious diseases specialist, and it's kind of tragic because it's largely preventable. And so it's got a lot of levels of badness.
And so for people outside Alberta, and I know this was touched on just a moment ago with Mark, but let me ask you, why is the number of cases so high in Alberta?
Well, I mean, as we learned in COVID, network spread is a real issue. And for measles, because it is so contagious, if a person with measles is in close proximity with people who are under-vaccinated, you can have really explosive growth of an epidemic. And so if people are in a network where there is a lot of vaccine hesitancy and under-vaccination, we see these numbers just continuing to grow, and they're probably underreported as well. And so, it's really a feature of who has measles and who they're in contact with. And I think a lot of places across Canada are vulnerable to this type of issue, honestly.
So as I understand it, Dr. Saxinger, no measles-related deaths have been reported in Alberta. So some people may be wondering, why should we be concerned about the number of measles cases?
Well, I mean, if you just go by the numbers, we're somewhat overdue for a severe consequence of measles infection because we know worldwide measles continues to kill people every year, especially children under 5. And it can also leave people with lifelong impairments after severe infection. Even people who just have a normal measles illness with rash and fever, et cetera. It's a whole body infection. It can affect your immune response for some time after infection. And so there can be ongoing consequences for the individual, but also really serious consequences for healthcare systems and capacity to deal with patients who have acquired this preventable disease.
You're an infectious diseases doctor, a specialist. You spend time seeing patients. You spend time in hospital. Are you seeing the impact, at least in your circles, professional circles, of these measles numbers?
I would say yes, but I mean, so far, a lot of the cases have been concentrated in smaller hospitals and smaller communities. Now we're starting to see inroads into Edmonton and Calgary. So, I mean, my role has been doing a lot of phone advice support for things like a pregnant person with measles and whether or not there's any treatment that would help reduce the risk to their baby and that kind of thing. A lot of the hospitalizations have been in smaller hospitals, which obviously has a bigger impact proportionally to the care they can provide there. And even a single case in a hospital setting requires extensive contact tracing and really very rigorous infection control practices. And so there's a lot of health care around every single case.
One interesting thing when we look at the U.S. numbers is that the number of reported cases there is fewer, I think, than even the province of Alberta, and yet they've had a handful of measles-related deaths. What does that suggest to you?
They also have a higher hospitalization rate, and so those two things do make me wonder if there's more significant undercounting of cases. I mean, if we assume the populations are otherwise somewhat similar for risk of severe outcomes, the higher numbers they're posting for both hospitalization and also the very tragic deaths that they've seen already would suggest that they might have more cases than the official case count, which would be not uncommon if you're dealing with a population that's not necessarily coming forward for care.
You said what's happening in Alberta, there's the possibility that this could happen in other communities across the country, particularly when it comes to communities that are under-vaccinated. And so let's finish with this. What message do you have for parents in particular, for people generally, about measles in Canada right now?
We can no longer take for granted that it's not a real risk. It's a very real risk across much of Canada, especially in Alberta right now. And so if you do not have 2 doses of measles vaccine documented, you have an opportunity to address your risk by getting vaccinated. And for parents, looking at your kid's vaccine status before the school year might be very important because that's another big gathering time that I consider quite high risk. And, it might have been something that was off the radar because of concerns related to disinformation. But now that we're seeing the real risk coming in, people might want to really reevaluate that risk-benefit discussion and look for some good information to counter their disinformation concerns.
Always appreciate your time and your expertise. Thank you very much.
Thanks for having me.
Dr. Lynora Saxinger, an infectious disease specialist at the University of Alberta.